Hello health enthusiasts, welcome to another enlightening episode on our channel. As a cardiologist specializing in heart rhythm disorders, it's my mission to educate and inform about heart health. Today, we're tackling common cardiology myths that might be leading you astray. We'll delve into topics from heartbreak to exercise, from arrhythmias to age-related heart diseases, and much more. Being well informed about heart health is crucial for everyone. So, gear up as we dive into the world of cardiology and debunk some widespread myths. First off, have you ever heard the term dying of a broken heart? While it may sound like a dramatic line from a romantic novel, there's medical truth to it. This brings us to the first myth we're debunking today. Heartbreak is just a figure of speech. Let's delve into the concept of stress-induced cardiomyopathy, also known as broken heart syndrome. This condition, despite its poetic name, is a serious health concern that can strike even if you're healthy. It can be triggered by extremely stressful events like the death of a loved one, a bitter divorce, or even losing a lot of money in the stock market. This syndrome occurs when a part of your heart temporarily enlarges and doesn't pump well, while the rest of your heart functions normally or with even more forceful contractions. It might surprise you to learn that the symptoms are similar to those of a heart attack, including chest pain and shortness of breath. So what's happening here? Emotional stress can indeed impact your heart physically. When you're under intense stress, your body releases hormones like adrenaline that can stun the heart, leading to sharp chest pain or even heart attack-like symptoms. The good news is, unlike a heart attack, broken heart syndrome is usually treatable and most people recover fully with appropriate medical attention. Still, it's a potent reminder of how closely linked our emotional and physical health are. So it turns out, heartbreak is not just a figure of speech. Now let's tackle the myth that all arrhythmias are dangerous. Arrhythmia simply refers to an irregular heartbeat. It's like the drummer in the band of your heart missing a beat or playing a little off tempo. But just like a band, a small hiccup doesn't always mean disaster. There are many types of arrhythmias, and not all of them are cause for concern. For instance, have you ever experienced your heart skipping a beat when you're startled or excited? That's a type of arrhythmia called a premature beat, which is usually harmless and doesn't necessarily require medical attention. Another common type is sinus arrhythmia. This natural variation in heart rhythm often occurs in young, healthy people and is typically not dangerous. In this case, the heart rate increases during a breath in and decreases during a breath out. On the other hand, there are arrhythmias that can be serious. These include conditions like atrial fibrillation, ventricular tachycardia, or bradycardia, where the heart beats too slow. These conditions might require medical attention and possibly treatment. The key here is to know your body. Regular checkups and conversations with your healthcare provider can help determine if your heart rhythm should be a cause for concern. In summary, while some arrhythmias can be life-threatening, many are benign and part of the normal variation in heart rhythm. So the next time your heart skips a beat, don't panic. It might just be a harmless arrhythmia. Remember, not all irregular heart rhythms signal a severe problem. Moving on, we've all heard that exercise is always good for the heart, right? Well, not entirely. While it's true that physical activity can boost heart health, the impact of exercise isn't always black and white. Some might even say it's a matter of heart. In reality, the intensity and type of exercise can have different effects on different people, particularly those with specific heart conditions. For instance, high-intensity workouts could potentially pose risks for individuals with coronary artery disease. Similarly, certain types of exercise might not be recommended for those with heart rhythm disorders. It's also worth noting that starting a strenuous exercise regimen without proper preparation can actually put stress on the heart. This is why it's crucial to gradually increase the intensity of workouts, giving your heart time to adapt to the increased demand. Does this mean you should avoid exercise if you have a heart condition? Absolutely not. Exercise, when done correctly, can be a powerful tool for maintaining and improving heart health. It's all about finding the right balance and the right type of exercise for your specific situation. This brings us to the importance of consulting a doctor or a qualified health professional before starting a new exercise regimen. They can guide you in choosing exercises that are safe and beneficial for your heart, taking into account your overall health and any existing conditions. Exercise is beneficial, but it's not a one-size-fits-all solution. Next up, is heart disease only a concern for the elderly? The simple answer is no. It's a widespread misconception that heart disease is an ailment reserved for the silver-haired among us. In reality, heart disease can affect individuals of all ages. Let's delve into some statistics and facts. Heart disease is indeed the leading cause of death for people aged 65 and over. However, according to the American Heart Association, nearly 1 in 3 deaths due to heart disease occurs in people under the age of 65. Furthermore, the incidence of heart disease in younger populations is on the rise, a trend that is largely attributed to lifestyle factors. These include unhealthy diets, sedentary lifestyles, smoking, and excessive alcohol consumption, all of which can contribute to the development of heart disease. The prevalence of heart disease in younger people should serve as a reminder that heart health is not just a concern for the elderly. We must be mindful of our lifestyle choices from a young age. Regular exercise, a balanced diet, and regular medical checkups are essential at all stages of life. It's also worth noting that certain risk factors can increase the likelihood of heart disease at any age. These include high blood pressure, high cholesterol, diabetes, obesity, and a family history of heart disease. So it's clear that heart disease doesn't discriminate by age. It's crucial to prioritize heart health. No matter how many candles are on your birthday cake, heart disease doesn't discriminate by age. Ever heard that a normal ECG means a healthy heart? Well, it's time we debunk this myth. An electrocardiogram, or ECG, is a valuable tool in assessing heart health, but it doesn't tell the entire story. The ECG measures the electrical activity of the heart, how the heart beats. It can detect abnormalities in heart rhythm, heart attacks, and even some structural issues, but it's not a comprehensive tool. There are several heart conditions that an ECG might not pick up. For instance, it may not detect blockages in the arteries until a heart attack occurs. It also doesn't give information about the heart's pumping power or the condition of the heart valves. Moreover, an ECG captures a snapshot of the heart's activity at a particular moment. Some heart conditions, like intermittent arrhythmias, might not show up during that brief period. It's also worth noting that heart health can change over time. A normal ECG today doesn't guarantee a healthy heart tomorrow, especially if risk factors like high blood pressure, diabetes, or high cholesterol are present. Therefore, a comprehensive cardiac evaluation is crucial. This may include additional tests like an echocardiogram, a stress test, or a coronary angiogram, depending on your symptoms and risk factors. Regular checkups and monitoring of risk factors are also essential. So remember, a clear ECG is not an all clear for heart health. And lastly, are natural supplements always safe for the heart? Let's dive into this common misconception. The world of supplements can be a bit of a wild west, with many products boasting heart health benefits, but it's crucial to remember that just because something is natural doesn't necessarily mean it's safe or beneficial for your heart. You see, some supplements can interact negatively with heart medications. For instance, St. John's wort, a supplement commonly used for depression, can reduce the effectiveness of heart medications like digoxin. Similarly, the popular supplement ginkgo biloba can interfere with blood thinners, increasing the risk of bleeding. Even vitamins, when taken in excess, can cause issues. Too much vitamin E, for instance, has been linked to an increased risk of heart failure, and high doses of vitamin K can counteract the effects of blood thinners. So, while some supplements may indeed have heart health benefits, it's important not to self-medicate. Always consult with your healthcare provider before starting any new supplement regimen. They can help you understand potential interactions and side effects, and guide you on the safest path to better heart health. In conclusion, it's not enough to just pick up a bottle with heart health on the label and assume it's good for you. Be proactive, be informed. Supplements can be a part of your wellness strategy, but they should be used wisely and under the guidance of a healthcare professional. Remember, natural doesn't always mean safe. As we wind up, let's revisit the truths we've uncovered today. Heartbreak is more than a figure of speech. Not all arrhythmias are dangerous, and exercise isn't always beneficial. Heart disease doesn't discriminate by age, a normal ECG doesn't guarantee a healthy heart, and natural supplements aren't always safe. Remember, your heart is unique, and so are its needs. Seek advice from a cardiologist for any concerns. Don't forget to like, subscribe, and share this video for more insightful content on heart health. Until next time, stay healthy.